Good afternoon, everyone. Welcome to this week's edition of Oxwide. I've got a bit of a twist on the usual format today, where I'm going to be interviewed by Dr. Ify Okocha, but I'll say a bit more about that in a minute. First, I wanted to say a few things once again about COVID, which has been a regular feature, hasn't it, of all of our lives over the last 18 months or so. What we're seeing at the minute is a combination of two things. One is that the government is keen to move away from mandatory guidance around the wearing of face masks and social distancing, and to place a much bigger emphasis on social responsibility. And so from the 19th of July, the rules that are in place around things like mask wearing in public and social distancing in public are going to become about personal responsibility and choice. And it's worth bearing in mind that we're talking about an infectious disease here that can be spread by people who are not aware that they are carrying it. And as a result, that personal responsibility and choice isn't just about your own choice affecting yourself, it's about your choice affecting those around you. And as a result, there is going to be a really big push, working with colleagues in places like Transport for London and others, to emphasise that in London we want to see people taking that personal responsibility seriously. When you make a choice about whether or not to wear a mask in a public space, particularly in an enclosed public space, it's not just for your own benefit, it's for those around you. We'll continue to see that emphasis that you need to, hands, face, space. If you're outside in the fresh air around people, very, very low risk there. There's no real risk of transmission in those environments. But when you get into those closed internal spaces, do have a think about your choices and how that affects those who are vulnerable around you. The guidance for the public does not apply in healthcare settings, and we're waiting at the minute to find out what's going to be said about NHS staff, those of you working in clinical environments, and also those of you working in enclosed inside environments with colleagues where you're not perhaps able to socially distance. So please keep an eye on the Ox and listen to what your team manager and others are saying about the ongoing use of masks, infection prevention and control. And certainly approaching the winter, the need to keep that hand washing and to keep yourself protected is very clear, because the Delta variant, we really are seeing some really quite stark increases in the spread, both amongst the younger population, but also over the last week or so, as Ify and I were hearing last night, in the over 60s and in that more vulnerable population. Vaccines have clearly made a big difference here, because the number of people who are becoming seriously unwell with COVID and are ending up in hospital as a result of Delta infection is lower than it was in earlier peaks and earlier waves of the pandemic. And the vaccine protection is a good thing to have, but a 90% vaccine still means people who've been vaccinated will become infected and will become sick and can pass on the infection. If you haven't had your vaccine, please do so now. If you haven't had your second vaccine yet, make sure you've got it booked in, make sure you've got it due, because it's the best way to make sure you're protected with the people around you. So I've had 2 vaccinations. I'm still conscious of that risk that COVID poses to me and my health and to the health of those around me. Okay. So, onto some personal news after that as well. After almost 3 years in post, I've handed in my resignation as Chief Exec of Oxleas, and I'll be leaving the Trust shortly to join Barking, Havering and Redbridge University Hospitals, so that's an acute trust in North East London, as their new Chief Exec. I've had a fantastic time here. It's been a real privilege to be part of the team here, and be very sad to leave so many wonderful people. But equally I'm excited about the opportunity to go and take on this new role in North East London. But for a bit of a change on the Oxwide format, I'm joined now by Deputy Chief Exec and soon to be Interim Chief Executive, Ify Okocha, who's very much lived up to the Deputy CEO title since he accepted it a couple of years ago. And Ify will be taking over as our Chief Executive from next month. So Ify,
Thank you, Matthew. That's quite a news you've just given us. Tell us a bit more about this new job that you're going to.
Yeah, so as you know, I was working in the acute sector before I came to Oxleas, with colleagues at the Prue in Bromley, and regularly meeting people like Abby Fadipe and others in the liaison team there. And I was approached earlier in the year to see if I was interested in a move back to the acute sector, and BHR is a trust I've known over the years. I know colleagues in North East London at Barts and elsewhere, and having talked to Mike Bell, who's interim chair there, and then to people at the Trust, I think it feels like something where I can really get my teeth into, both taking my learning from the Prue, but also lots of what I've learned at Oxleas about what it means to be part of a strong leadership team. Some of the real focus we've had on a positive culture here as well, and I think that combination of of experiences means this is a really exciting opportunity for me, sad as it will be, to move on.
Of course. Can you say a bit more about what you'll be taking from Oxleas? What have you learned here that you think will be really helpful in your new role?
Yeah, I mean, when I was at the Pru, there's some great people there, but we were all working incredibly hard, I think quite often in quite isolated posts to try to make things happen. And I suppose there's a couple of things I've really learned at Oxleas. One is the importance of building really strong teams. And I think the exec team at Oxleas is a fantastic team to be part of. Lots of real expertise in the executive team here, mutual respect and support, and people who are quite happy to get involved beyond their own specialty to support colleagues to achieve things. I've learned a lot about the importance of an open and transparent culture as well, a culture where we don't apportion blame when things go wrong, but we seek to learn from it and to improve off the back of it. And I think while COVID has been frustrating in that there's some parts of organisational development I'd wanted to have pushed more at Oxleas if we hadn't had the pandemic, the building a fairer Oxleas work's probably been the highlight of my time here. And I think actually there were simmering problems within the trust and within the NHS that were brought to a head through the pandemic that we perhaps wouldn't have confronted otherwise. And I think that work to really understand the experience of colleagues from ethnic minority backgrounds, but other colleagues who experience difference and diversity, I don't think that would have come to the fore, and I'm really looking forward to taking some of that with me to BHR.
So that's a lot of really positive stuff, but are there any things you would highlight as things you really enjoyed about Oxleas?
The thing I've most loved about Oxleas is getting out into the services. There's such a diversity of services here. You know, whether it's spending time with Taffany's colleagues up at Swaleside in the prisons, whether it's in the forensics units at the Bracton and in Greenwich and elsewhere. You know, visiting our inpatient units, spending time with district nurses, you know, the speech and language therapists. There's so many different teams here, and you know, to be honest, I could have spent every day of the last 3 years visiting a different team. And the energy and the passion for improving lives that comes through from our staff. And I think the way that the values have come together, you know, we're kind, we're fair, we listen and we care. The people at Oxleas embody for me the very best of the NHS, and what I've loved so much is spending time with them, listening to them, listening about the things we can do as leaders to try to support them to do their job better. And also working with people like you, Ify. You know, you and the exec team have been great colleagues, and sometimes these jobs are quite lonely. And actually I've really relied on the sort of support and the friendship and the comradeship we've had amongst the exec team as well to get through some pretty tough times in the last 3 years. Greatest challenges?
There are always some in jobs like this,
There is, and you know, I mean, the money's always a concern. You know, in our roles, part of the job of chief exec is to make sure that your clinical staff have got the resources you need. And I worked at King's when it went into financial special measures, and that was hard. And one of the things I've been keen at with Oxleas is to keep us in a balanced position where we can give our clinical teams the resources they need to do the job to the best of their ability. And we could always have more money, we could always spend money. And I suppose there's a really important link in the NHS between having the money and the resources you need and being able to deliver the right care. So some of that, I don't know if a lot of our staff see it, but that occupies quite a bit of my time. The other thing is whenever I've encountered circumstances where I think unfairness has been evident, either in access to services or in the way people are treating their colleagues. And I think some of the most difficult conversations are those ones where we've really have to lift the lid on some pretty difficult, you know, the kind of stuff that makes people hate coming into work because they don't feel as though they're being treated fairly. And for me, that unfairness, whether it's in access to services or in the way people feel in the workplace, that's the stuff that actually keeps me awake at night. And that's the stuff where when we get it right and we manage to really tackle that, that's the stuff where I feel a real sense of satisfaction.
I mean, there's no doubt in my mind, and I'm sure in the minds of the exec and others in this trust, that you've done so much. It feels like 5 years. You know, it's difficult to believe you've only been here for 3 years. But are there things you wish you could have done if you had more time?
I think there always is. I mean, I think the mental health crisis pathway absorbs a lot of our time, doesn't it? It's, you know, it's a relatively small part of what we do, and yet the experiences of people when they're acutely unwell in mental health, you and I spend a lot of time talking about this. How do we get the right support to people then? How do we support our crisis home treatment teams, our AD liaison teams to work that through? How do we make that connection then with what happens in the wards and support and discharge back to the community? That I suppose I feel we've made real progress in that, but I still don't feel we've got the model there where it needs to be. I think that's hard work. I'm also, I know this, I don't mean this to sound at all glib either. I think it's always frustrated me how much some of our community teams spend dealing with things like parking. And dealing with the difficulty of trying to deliver a service in someone's home when you have to travel to their home, and increasingly it's hard to do for them. And I speak to some great clinical colleagues who burn a lot of their energy and effort dealing with non-clinical interruptions and difficulties, and I've got to be honest, I feel as though we've spent a lot of sweat going round and round in circles on that, and not necessarily getting the traction we've wanted to. I don't play that down, because it does upset people, and if there was anything else, I think there's something about what we can do with primary care. And the PCNs, the primary care networks, came into being just before the pandemic, and they have just done a brilliant job on the vaccination programme. That's been NHS led and delivered. Jane and her team have done a smashing job on vaccinating our staff and other healthcare providers. But primary care has been focused on that. But we need to do more with primary care to bring them into the way that we deliver our community services for physical and mental health care. And I think just this week I've been having some great conversations with colleagues in primary care in South East London. That for me is very much unfinished business, and has to be a big part of what we do in the next couple of years.
That's fantastic. I know you're still here for a few more weeks, but is there any advice that you like to leave colleagues?
I think we've been through a really bruising 18 months. We've all experienced loss. We've experienced personal loss, professional difficulties, and we've also socially been through a process of trauma. And trauma, as you know better than I do, Ify, but it's about something that fundamentally changes your sense of your relationship with the world around you and the people around you. I think we need time to absorb what's happened to us all. We need time to focus in on what we've learned about what's important in the world. And one of our values first and foremost is to be kind. And I think it's to keep that spirit of compassionate leadership going, to take the time to listen to what our staff are telling us about what it's like to work here. And the fact we can, through the pandemic, we've made year on year improvements in our staff survey, really pleased with that. But also the work Neil's doing around involvement and listening to carers and service users and their family, and to take that spirit of kindness and compassion forward, and to be proud of the great care we deliver, but to recognise that it's by listening to those people who can tell us about what it's like to work here and be cared for by us, that's how we get stronger. But I couldn't have asked for a better colleague than you, Ify, and if there's a sense of passing on the baton, it's a privilege to be able to look to you and to say, here you are, Ify. You've been a great servant of Oxleas in the NHS, and the trust couldn't be in better hands. I also need to say that I don't know how much time people spend thinking about the relationship between a chief exec and a chair. I wouldn't have come to Oxleas without Andy Trotter. He came to visit me at the Prue, and I spend a lot of time talking to Andy. He's an enormously experienced individual. He has wonderful values, wonderful operational insight, and the way in which he's often gently steered and pushed me to do the right thing for the trust and for our populace. That chair relationship's been integral to here, and I will really miss working with Andy, and I hope he and you and I and so many other colleagues here, including the choir, people we've made music with and others, I'm really looking forward to maintaining those relationships over the years to come.
Of course. But just for me to say on behalf of the board, the exec and Oxleas, and on my behalf as well, thank you very much. I think your leadership has been inspirational. Like I said earlier, it's difficult to believe that you've only been here for coming up to 3 years. It feels like you've been here a lifetime. It'll be big shoes to fill. So, you're going to get calls from me, text messages, WhatsApp, as we often do, for more mentorship and guidance, etc. But thank you so much for everything you've done for Oxleas, and I look forward to hearing of bigger and greater news, about your successes in the NHS.
Thank you very much, Ify.
And just before we go, we thought we'll keep Oxleas, alive in your thoughts. You've talked a lot about our values. We've got a few goodies here to do with our values that we want to leave you with.
Thank you.
And I'm sure you you'll remember us. No,
Of course I will. I'll never
go.
forget what I've learned here, Ify. Thank you so much.
Okay, thank you.
All right. Thanks, folks. Thanks, Ify, and thanks, colleagues. And I will be here for a wee while, a short while yet, and I'll be making time to speak to as many of you as I can before I leave. Just one thing I wanted to say before I leave, which is that you don't often see Steve Cooksley, who's behind the camera here, but I've made part of my mission in life to make Steve's life as difficult as possible because he's so good at his job by turning up late, unbriefed, and charging into these Oxwide things with him. And he's been a great colleague and a great friend. So I want to say thanks to Steve because he won't let me do it otherwise if he gets wind of it. But thanks all of you. I love working here, and Oxleas will always hold a very special place in my heart. So I'll see you probably for one more Oxwide before I go, but thanks to everyone. Have a lovely weekend and speak to you all soon. Bye bye.